Liberty Tree. We're really glad to be back. We have been negligent.
Yeah.
Would that be the right word?
It's been very busy.
We have been very busy. We've had a lot going on.
Crazy busy.
We would like to ask you to like and subscribe. Yeah,
I know. We promise we'll do more episodes coming
I
up.
hate that. And also, just I have to say that this continues to be an ongoing theme for me. This is the number of days since I have cared about who the presidential candidate is, and I just want to continue to call that out because it's really, really important to me that everyone understand that it doesn't matter in the least who the presidential candidates are. And right as it stands right now, it's been 210 days since I have cared. No, sorry, 910 days. And that's because actually, this is part of what we're going to talk about today. We're probably going to get canceled, which is why it's
Again, canceled again.
well, I've been shadow banned, but I think when you see what I'm going to bring up today, I think we may get completely taken off of YouTube and Facebook because we are going to share some misinformation from a crazy right-wing website. I mean, honey, this is so far out there.
No, you've got my
I
interest
mean,
peaked.
you're not even gonna see.
Yeah, 'cause I have no idea what he's bringing up.
No, that's right. Well, one of the things we've decided to do
It's a
is kind of
surprise.
is
Yeah.
kind of make
Surprise
this
each other
a
with
present
things.
to each
Yeah.
other, where we just kind of talk about it because we realize that the conversations we have over there at 5:30 in the morning are better than
4:30 in the morning.
are better than the show. And so we've decided that we're going to kind of just surprise each other
Yeah.
and talk about it
Yeah.
live because that's more interesting, at least to us. So here's what I want to talk about
Okay.
today. I want to talk about the epidemic that wasn't, but that talking about the epidemic that wasn't may get us canceled. So what I'd like to do, the ground rules for this discussion are we cannot make any reference to any recent problems related to people's health.
Or this thing, or
Right. We can't make any, we have to pretend that none of that happened.
okay.
And this is the test. This is to see whether or not you can get canceled for simply making reference to some old right-wing story that was out there. So I was browsing the interwebs and I came across this story on Twitter. And it's very interesting in my opinion because it brings up a topic which we're not allowed to talk about. And it does so in a very interesting context. So I don't know if you can see that. I'm gonna zoom in on that so that you can see that because I want you to be able to see this. This is a tweet, and what it references is a New York Times story. And this is the title of the New York Times story: "Faith in Quick Test Leads to Epidemic That Wasn't." Now look at the date on that. January 22nd, 2007. So for the censors out there, this could be in no way related to anything having to do with a recent event, right? Because in 2007, we had how many kids? 3?
No, 5.
We had 5?
Lindsay was born in 2008.
Okay, so we had 5 kids, and we were young and in love. I mean, we're still young and in love, but this was a long time ago. And so to all the censors out there, just stop it. We're not talking about anything that isn't old and unrelated to anything that might be going on.
Yeah.
It's completely and utterly unrelated, okay? So that's the setup.
Okay.
The next thing I want to do, and I don't like that. There we go. The next thing I want to do is go to the next page, which is just actual story. Okay. So I'm going to walk you through this, and I want you to see if you can let me read this to you, completely unrelated to anything that might be in the news now. Okay. So no reference to anything in the news now. This is just an interesting story from a very right-wing Times, the New York Times, because back in 2007,
I'm sorry. You said this was coming from a right wing.
Well, back in 2007, apparently, they were very right-wing. And here's why. Experts, now remember, whenever you see experts, That means these people know.
Experts.
No, these people know, honey.
Yeah, they know.
Because the experts are never wrong. Oh, I
Yeah.
saw this really cool tweet. I hope I can remember it. The tweet said that computer modeling is modern day divination.
Oh, that is good.
And I love it. I'll
That
see
is
if I
very
can
good.
find that and
Yes.
share that link. But I thought that was fantastic. So experts say tests that led to a false alarm at a New Hampshire hospital are coming into increasing use. So remember, this is 2007. This has nothing to do with anything at all.
Yeah.
And I don't know why the date is June 10th. I'm not sure why that shows up there, but the timeline on this story says 2007.
Well, they must have
Dr. Brooke
reissued.
Herndon, maybe, an internist at Dartmouth Hitchcock Medical Center, could not stop coughing. For 2 weeks, starting in mid-April last year, she coughed seemingly nonstop, followed by another week when she coughed sporadically, annoying, she said, everyone who worked with her. Now, before long,
2 weeks. That's
Dr.
like,
Kirkland,
it's just the flu.
who is an infectious disease specialist at Dartmouth, had a chilling thought. Could she be seeing the start of a whooping cough epidemic? By late April, other healthcare workers at the hospital were coughing, and severe, intractable coughing is a whooping cough or whooping cough. Whoopee! Hallmark. And if it was whooping cough or whooping cough, which would you prefer me to say?
Whichever
the
floats your boat.
The epidemic had to be contained immediately because the disease could be deadly to babies in the hospital and lead to pneumonia in the frail and vulnerable adult patients there. So, okay, great. It was the start of a bizarre episode at the medical center, the story of the epidemic that wasn't. For months, now remember, this story is in no way related, not even in the least, to any modern story. It has nothing to do with anything that's in the news or has been in the news recently. I just want to be perfectly clear about that, right? This is nothing to do with anything except the story that it is, okay? So let's keep that in mind. Let's not draw any unnecessary conclusions or make any connections to any modern story. For months, everyone involved, nearly everyone involved. So a consensus? Would it be fair to say a consensus
Well,
form?
nearly everyone, I would say.
Nearly everyone involved thought the medical center had a huge whooping cough outbreak with extensive ramifications. Nearly 1,000 healthcare workers at the hospital in Lebanon, New Hampshire, were given a preliminary test and furloughed from work. So they weren't allowed to work because they could be a danger. Until the results were in. 142 people, including Dr. Herndon, were told they appeared to have the disease, and thousands were given antibiotics and the V word for protection. Now remember, this is a 2007 story. It has nothing to do with anything. Hospital beds were taken out of commission, including some in intensive care. Then, I don't even know. Can I say this? I don't think I can say this.
Go for it, baby. Go for it.
Okay, well, but I'm going to take just a moment, though. I'm going to ask you to like and subscribe, and especially subscribe at Rumble, because we are this close to being able to syndicate at Rumble, but we need more people to go over there and like and subscribe.
Yeah, and we promise we really are going to get to putting out more.
But the key is when we get
episodes.
canceled on YouTube and Facebook, you're not going to be able to see us here anymore, because we're not going to stop talking about things like this story from 2007 that has absolutely positively nothing to do with anything that has been in the news recently.
Well, I'm dying to know what happened.
So 8 months later, healthcare workers were dumbfounded to receive an email message. Remember the rules. What are the rules? You can't make any reference to a modern thing. That's very important, because this is a test.
My lips are zipped.
Yeah, but they won't be. And about 8 months later, healthcare workers were dumbfounded to get an email message from the hospital informing them that the whole thing was a false alarm. Now remember, this has nothing to do with anything that's happening now. Not a single case of whooping cough was confirmed with the definitive test, which is growing the bacteria, Bordetella pertussis, in the lab. Instead, it appears the healthcare workers were probably afflicted with some kind of ordinary respiratory disease like the common cold. Now, as they look back,
I can feel the fire.
I know.
rising.
That's why I told you I set the rules up ahead of time. Now, as they look back on the episode, epidemiologists and infectious disease specialists, would you say those are experts? Epidemiologists?
They would say they're experts.
So as they look back, they say the problem was they placed too much faith in a quick and highly sensitive molecular test that led them astray. It was the test. The test, they placed too much faith. Their problem, you know what their problem is, honey? They care too much and they work too hard. That's their weakness.
Oh,
They just care too much. And so they placed their faith in this test, and the test turned out, the test led them astray. There it is, right? It's like when they do the story about the SUV that ran over 3 people.
Yeah.
Right? Infectious disease experts say, now remember, this is the right-wing New York Times from 2007. So this has nothing to do with anything today. Don't read ahead.
Okay.
Infectious disease experts say such tests are coming into increasing use and maybe the only way to get a quick answer in diagnosis diseases like whooping cough, Legionnaire's disease, bird flu, tuberculosis, and SARS in deciding whether an epidemic is underway. Now remember, the test, because they placed too much faith in it, led them astray. There are no national data on pseudo-epidemics caused by an over-reliance on such molecular tests, said Dr. Prish Pearl, an epidemiologist, she'd be an expert, at Johns Hopkins. And the past president of the Society of Healthcare Epidemiologists. So she's not a nobody. She's the past president. She said pseudo-epidemics happen all the time. Now, this is in the past. It has nothing to do with anything that happened recently. The Dartmouth case may have been one of the largest, but it was by no means an exception. So what does that say to you about this problem? Is this an uncommon problem or a common problem?
Am I allowed to talk now? Can I?
Well, you can talk.
Unleash the beast?
No, you can't. You have to answer the specific questions following the rules. Because remember, we're not talking about anything that happens in modern time. But what does it tell you if it says that this was by no means the exception?
Okay. Well, what the experts were saying in this article was that they were having a problem that the tests were a little bit inaccurate.
Right.
And yet they know that they have to test more because they have so many diseases that they can supposedly test for.
Here it is. There was
even though they're inaccurate.
Well, no. You could. They did find out that you could test. Sorry, this is getting a little loose here. They did find out that you can test. They do the actual culture.
Oh well,
that's how they knew that nobody had
the
disease
the
that
other
everybody
test that
had.
they're using is.
The other test is a definitive test.
Yes, because
when
it's
you
a
grow it in a
petri
culture,
dish.
right? That's the standard.
And that's when that's what really bugs me when parents, moms will say,
"Okay, just be careful. Don't go."
My son or my daughter has strep. They went to the doctor that day, and they're sent home with the antibiotics because the doctor or the nurse said, "Oh, well, she has strep." You can't know it's strep unless you do a petri dish.
Right. And Dr. Trish Pearl, as we find in our 2007 story, this is not a modern story, this is an old story. Dr. Trish Pearl, who's an epidemiologist at Johns Hopkins and also past president of the Society of Healthcare Epidemiologists in America. So not Joe Rogan. Sorry, I made a modern reference. My bad. She said pseudo-epidemics happen all the time. The Dartmouth case may have been the largest, but it was by no means an exception. There was a similar whooping cough scare at children. Oh, well, that's an interesting word to use. At Children's Hospital. Not that that's related to anything that recently happened, because it couldn't possibly be.
No.
At Children's Hospital in Boston last fall. Said that 36 adults, 2 children, definitive tests, which is not what this test was, that was used in 2007. Don't read ahead. Did not find pertussis. It's a problem. We know it's a problem, Dr. Pearl said. My guess is that what happened at Dartmouth is going to become, what do you think she was going to say? More common or less common?
More common.
More common. Right. Why? Because they blame the test and they say we had too much faith in it.
Yeah, and we're going to use it more often.
Many of the new molecular tests are quick, but technically demanding, and each laboratory may do them in its own way. These tests, called home brews, are not commercially available, and there are no good estimates of their error rates. But their very sensitivity makes false positives likely, and when hundreds or thousands of people are tested, as occurred at Dartmouth, false positives can make it seem like there's an epidemic. So I'm going to ask you a question, and this is totally unrelated to anything that's happened in the modern era. This has nothing to do with anything you've ever experienced. But if hundreds or thousands of people testing can make it seem like an epidemic, what what do you think would happen if millions of people were tested? Do you think that could make it seem like there's an epidemic?
Nah.
You're in a little bit of a no man's land, said Dr. Mark Perkins, an infectious disease specialist, so probably an expert, chief science officer at the Foundation for Innovative New Diagnostics, which is a nonprofit foundation supported by
Oh,
Bill
why
and
am I
Melinda
not
Gates.
surprised?
He says, you're in a little bit of a no man's land with the new molecular tests. All bets are off on exact performance. So this is obviously not in any way related to anything that just recently happened. Of course, the right author says that leads to the question on why rely on them at all. Now, that is a question that if you'd asked in the last 2 years, got you canceled. But at face value, obviously, they shouldn't be doing it, Dr. Pearl said. Now, just to remind you, Dr. Pearl is funded by
Bill and Melinda Gates.
And he's an infectious disease specialist. She. I apologize. Misgendered. It's Dr. Pearl is a she. But she said often when answers are needed in an organism like the pertussis bacterium is finicky and hard to grow in a bacteria laboratory, you don't have great options. Waiting to see, Dr. Pearl said, if the bacteria grows can take weeks, but the quick molecular test can be wrong. It's almost like you're trying to pick the least of two, fill in the blank, you know what the word is, evils, right? That's what you say, the least of two evils. Well, now, if you're picking,
Really?
you see where this is going? Don't read ahead. The audience can see this, but you don't get to see it.
Very disheartening.
At Dartmouth, the decision was to use a test. Can you guess what the test was?
The PCR.
PCR.
Yeah. How did I know that without even looking ahead?
I don't know, because this has nothing to do with anything that has happened recently. This is absolutely nothing. It's called the polymerase chain reaction. It's a molecular test that until recently was confined to molecular biology laboratories. That's kind of what is happening, said Dr. Catherine Edwards, an infectious disease specialist and a professor of pediatrics at Vanderbilt University. That's the reality out there. We are trying to figure out how to use methods that have been the purview of bench scientists. This is 2007.
Am I wrong in remembering that Vanderbilt is one of the hospitals that is pushing mutilation surgeries for children?
You're not wrong. The Dartmouth whooping cough story shows what can ensue.
I don't think it's a far stretch to connect
To say-
those
no,
two evils
no,
in one
As
hospital.
long as I don't even know, you can't even do that. I'm not even sure that's legal, because you may have just gotten us canceled, which, folks, is why we are asking you to go over. It's really important. Go over to Rumble and subscribe. Like and subscribe at Rumble. Ask to follow, or Gab TV. You can also do YouTube and Facebook, because we will continue to use those as long as they'll have us. But this is pretty much the end of it, right? I don't see how they can keep us on after this, okay? But here's the thing. Here's the end of the story. To say the episode was disruptive was an understatement. Now, this is a little New Hampshire problem in Dartmouth, said Dr. Elizabeth Talbot, the deputy state epidemiologist for the New Hampshire Department of Health and Human Services. You cannot imagine, Dr. Talbot said, you can't imagine this. See, because you're not an expert.
Yeah.
I had a feeling at
just
the
a
time
mom.
that this gave us a shadow of a hint of what it might be like during a pandemic flu epidemic.
Oh, good grief.
Don't say what it is. You
Oh,
can't.
good.
You're not allowed to. Nope.
Great.
Nope, because the new rules are you can't notice this sort of thing. You're not allowed to notice this sort of thing. So we're just talking about a historical story. It has nothing to do. Yet, epidemiologists say one of the most troubling aspects of the pseudo-epidemic is that all the decisions seemed so sensible at the time.
I was just say it's pseudoscience.
Here's the funny thing about this. This was written in 2007, but it's ripped from the head. No, it has nothing to do. Sorry, I violated my own rule. It has nothing to do. Dr. Katrina Kestinger. Kretzinger. Oh, yeah, it's a German name. A medical epidemiologist at the Federal Center for Disease Controls and Prevention. So does that sound like an expert?
I trust the CDC with my whole
clearly,
being.
Clearly, because she's an expert. She worked on the case along with her colleagues, Dr. Manisha Patel. And they do not fault the Dartmouth doctors. This is very important. This is very, very important because we should never hold experts accountable. That's a very important scientific principle.
Yeah.
Experts are never wrong, and if you question them, you're questioning the science. And if they do turn out to be wrong, you can't question them. The issue was not that they overreacted or did anything inappropriate at all. That was perfectly normal. Instead, there is often no way to decide early on whether an epidemic is underway. There's just no way.
Yeah.
Before the 1940s, when a pertussis vaccine for children was introduced, whooping cough was the leading cause of death in young children. The vaccine led to an 80% drop in the disease's incidence, but did not completely eliminate it. So basically, this is just the cost of doing business. Whatever the experts say we need to do. That's because the vaccine's effectiveness wanes after about a decade. And although there is now a new vaccine for adolescents and adults, it's only starting to come into use. So whooping cough, Dr. Krestinger said, is still a concern. The disease got its name from the most salient feature, cough, 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 but neither coughing long or hard is unique to pertussis infections. Many people with whooping cough have symptoms like those of a common cold. Almost everything about the clinical presentation of pertussis, clinical presentation, especially early pertussis, is not very specific. Again, this has, I want to be super clear, this has absolutely nothing to do with any recent diseases or any recent problems. It's just completely and utterly unrelated.
Unrelated, totally.
Completely unrelated.
Yep.
And also,
Totally.
if you think it's related, you get canceled,
that's
okay?
right.
You can't talk about it because you're not a scientist. You're not an expert. So just do what we tell you because that's the new rules, right? There was the first problem in deciding whether there was an epidemic. The second was the PCR test. With pertussis, there are probably 100 different PCR protocols and methods being used throughout the country. It's unclear if any of them are accurate. We've had a number of outbreaks where we believe that despite the presence of positive results, the disease was not pertussis. And of
good
course,
grief.
we're talking about 2007.
Yeah.
So this is in 2019. Not that anything happened in 2019, but all of this information would have been completely unavailable to the experts. No one would have known this could be a problem. No one could have possibly anticipated this. At Dartmouth, when the first suspected cases emerged and the test showed pertussis, the doctors believed it. Not the doctor's fault. They just care too much and work too hard. The results seemed completely consistent with the patient's symptoms. That's how the whole thing got started. Then the doctors decided to test people who did not have severe coughing. Because we had cases we thought were pertussis and because we had a vulnerable patient population, we lowered our threshold. In other words, they made the test more sensitive. Anyone who had a cough got a PCR test.
I see.
No, that never. No.
Oh, okay.
Can't do that. And so did anyone with a runny
We
nose.
heard that just 2 years
No,
ago.
you said it. You're not allowed to say that. You can't notice any connection.
Say anything.
We tested anyone with a runny nose who worked with high-risk patients like infants. That's how we ended up with 134 suspected cases, Dr. Kirkland said. She added, that's why 1,445 healthcare workers ended up taking antibiotics and 4,524 healthcare workers at the hospital. 72% of all the workers were immunized against whooping cough within a matter of days. Because the one thing you have to do is you have to move quickly. You have to basically panic. If we'd stopped there, I think we all would have agreed that we had had an outbreak of pertussis and that we controlled it. There's the key sentence. If we had stopped there. Now, I'm not suggesting for a moment that in maybe a recent incident, we didn't stop testing before we knew that. I'm not saying that at all. That probably never happened. But what we did figure out from this, although we can't blame the doctors, but Dr. Kirkland said, if we had stopped testing there, if we just relied on this PCR test, we might have actually thought, we might have all agreed, she says, we all would have agreed that we had an outbreak and that we had controlled it. We would have patted ourselves on the back, President Trump. We would have patted ourselves on the back and we would have said, we did it. Look at all the lives we saved. But epidemiologists at the hospital, and remember this comes from right-wing news source, the New York Times in 2007, was extremely right-wing, so clearly it can't be trusted.
Yeah.
Epidemiologists at the hospital and working for the states of New Hampshire and Vermont decided to take extra steps to confirm that what they were seeing really was pertussis. Now, in the modern era, my understanding is that if you do try to confirm that sort of thing, you're getting canceled. So we're not. We're not asking for any
Nope.
confirmation. We
Nope.
trust the science.
Yeah.
Dr. Fauci is the science, and we believe him. We love him. The Dartmouth doctors sent samples from 27
You're
patients.
really overstepping. There's just only so much I can pretend.
The Dartmouth doctors sent samples from 27 patients. I will let you just rant at the end. But I think this article is really important. I wanted to take the time to go through the entire article because I think it's really important because it just so doesn't beautifully illustrate anything. 27 patients they thought had pertussis. They sent it to the CDC. The scientists tried to grow the bacteria, but after weeks, they finally had their answer. There was no pertussis in any of the samples. So in other words, even if you head down the wrong path, you could deal with it within weeks. You could get an answer within weeks if you actually cared to. We thought, well, that's odd, Dr. Kirkland said. Maybe it's the timing of the culture. Maybe it's a transport problem. Why don't we try serological testing? Certainly, after a pertussis infection, a person should develop
antibodies
to the bacteria. And you said that without looking at it. They could only get suitable...
Because I have common sense.
And you know science. They could only get suitable blood samples from 39 patients. The others had gotten the vaccine, which elicits antibodies.
I was going to say a weakened immune system.
Well, antibodies
Right.
in any case. And the CDC tested those 39 samples. And guess what they showed?
It actually, to be correct, a vaccine may elicit antibodies. It doesn't always elicit antibodies.
Right.
But that's getting
What we now know, though,
to
but what we now
conspiracy theory.
Yeah, what we
right?
now know,
Yeah.
right, though, is that a vaccine is anything that improves your chance of doing well with a disease. That's all it
That's all
requires.
it is, yeah.
They only got 39 samples. They had one that showed increased level of antibodies. The disease center did additional tests, including molecular tests to look for features of the pertussis bacteria. The scientists also did additional PCR tests from 11 of the 134 people. Only one was positive. The other test did not show that the person was infected. The disease center also interviewed patients in depth to see what their symptoms were. It was going on for months, but in the end, the conclusion was clear. What do you think the conclusion was? When they actually looked to see if the early, oversensitive, inaccurate test was right.
The conclusion is the PCR test is crap.
No, that would be a sane thing to say. But what they said was, there was no epidemic. We were all somewhat surprised, all of them. So in other words, the consensus of
Shocked
science.
that there's gambling going on in
So
this
I'm shocked.
establishment.
We were left in a very frustrating situation about what to do when the next outbreak
Epidemic,
comes. Dr. Kathy Petit.
Yeah.
Petty, an infectious disease specialist at the University of
Lord.
Rome, said the story had one clear lesson. The big message is that every lab is vulnerable to having, and this would have, if you make any reference to a recent event, we're talking about something that happened way back in Dartmouth in the 2000s, early 2000s. Every lab is vulnerable to having false positives. No single test result is absolute, and that is even more important with a test result based on PCR. As for Dr. Herndon, she now knows she is off the hook.
Well, good for Dr.
I thought
Herndon.
I might have caused the epidemic. But of course, no, she didn't cause it. She's completely blameless. She bears no responsibility, none at all. Now you can say whatever you want, because, if we haven't gotten canceled now, forget it. We're never getting canceled.
I have so many things. And I know you're thinking so many things because if you're watching us on our few
If you're still
episodes,
there.
we're still there.
That's why we need you to go
Okay.
to Rumble.
Is that you're thinking the same thing. But one of the things that really baffles me, bothers me, angers me, is the power that doctors have over people, the mental power.
Yeah.
Psychological power that doctors
Yeah.
have over people, even after what we've gone through since that year, 4 years ago, almost 4 years ago, right? Because really it was 2019 when it actually started, end of 2019. And it's really, they should not have that kind of power over people, over moms especially. They manipulate. I know I'm being generalized, but you've earned it. medical profession,
Yeah.
you've earned the disdain.
Yeah.
Because,
And not just now. Like, that's a 2007 article.
because this reminds
Bunch
me
of experts all know it doesn't work.
No.
They do it anyway.
And this just reminds me of when Nick was 9 years old, and we never immunized our kids for.
Did you just reveal that?
Yeah, I don't know, whatever. Okay, we never immunized her. A lot of people know
boy.
that. But okay,
Anti-vaxxer.
our fifth child, Nick, has Downs, and so we really try to walk a healthy line between taking him to the doctors he needed to see every year for certain checkups because he had ear problems.
We had
speech
ear surgery
problems.
done
We had
when
ear
he needed
surgery. You know, there were certain things we had to check every 6 months, every year. And we did that, even though we're very alternative healthcare aligned. But for our son's sake, there were certain doctors we had to see every year. And so I take him for his 6 month. I'm not going to say which kind of doctor or which doctor, even though it felt like a witch doctor. And one of the things that Nick still has an issue with is because of the Downs, he does not have a gag reflex, which meant twice when he was little, he almost choked to death. And he had to eat mushed up baby food until he was 5. Because he didn't have the ability to chew properly and swallow carefully. And so every time I would take him to his 6 month checkup, I would have to remind this doctor, doc, remember, Nick does not have a gag reflex. And so when they stick that Q-tip up his nose to take a mucus sample of the bacteria, I have to tell him before, please remember he doesn't have a gag reflex, and you have to give him warning because he's just a little guy and he can't talk very well and he doesn't understand very well what you're doing, shoving a Q-tip up his nose. And as I was saying, please, because I saw him, he was like rushing through everything and he's grabbing it. I'm like, oh my word, this is going so fast. Doc, you got to slow down. Please remember he doesn't have, and there goes that Q-tip up Nikki's nose, and Nikki starts choking and gagging and aspirating what was just released from his nasal cavity. Now I'm really, really upset because that is my precious pumpkin that this doctor is supposed to be caring for and listening to me because I'm his mom and I know every idiosyncrasy of my little Nick. And I felt disrespected that I was not listened to. And so 10 days later, where do you think Nick was? In the ICU.
Geisinger Danville.
With a blood oxygen level of 80% and falling. And doctors telling me they don't think he's going to live because he has bacterial pneumonia.
And RSV.
And the ER doctor who was taking such amazing care of him at Scranton Medical Center. It was just, she was phenomenal. The whole ER team there were phenomenal. And she's up, Nick's got a mask on and she's trying to save his life. She's literally on top of Nick on the gurney so that he can see her face through the mask. And she's saying, Nick, I'm going to save your life, buddy. You just keep breathing for me. And while she's talking to him, I'm relaying this to her, I'm telling her, please he's all of a sudden, he just crashed this morning. He just crashed. He was running around the house because you get this feeling of, because of the power doctors have over you, they are like, please understand, I promise he's been going to the doctor. Right. I've been doing everything I'm supposed to do. Right. And I don't, he just crashed. And she said, Mom, I got you. I know. And I told her he was just at the doctor 10 days ago. And I told her what happened. And he aspirated all the gunk out of his nose. And she said, a doctor made Nikki aspirate bacteria into his lung. And I was so shocked she actually told me the truth, because normally doctors don't do that. They don't rat on each other like that. Yeah. But she confirmed my suspicion that I knew, because the doctor didn't listen to me. My son's life was now in danger and now had to go through to Children's Hospital in Danville and be put through massive doses of 3 kinds of antibiotics, which for a child with Down syndrome is extremely debilitating to their immune system. And it was just put Nick through several years of really trying to get his immune system back on track because one doctor would not take 5 seconds to listen to a mother. And that's what really bothers me, that we go through these last 3 years, 3.5 years, and we're still coming out of this with doctors saying, no, you want a dead child or a boy? You want a dead child or a girl? And they still have not learned. You don't get to rule the world, doctor, medical community. You don't run this world.
Right, you work for us.
And it just, their chutzpah, their pride, the level of what they're idols. They worship themselves. They put themselves above everyone. And you think that because you read a bunch of books, like we can't read books? You think moms can't read books and understand the immune system? Let me tell you, I understood Nikki's immune system better than any doctor in that Danville Medical Center. I knew things that the doctors didn't even know because I read and I took the time to know. And that's what really bothers me is the temerity of these doctors, and then say, well, oh, thank God I didn't cause the epidemic. Whew, I'm off the hook.
I'm off the hook.
What? Doctors, you are not off the hook.
I'm going to go.
You are not off the hook.
Yeah.
You are mutilating children.
Yeah.
And you are allowing it to happen because you're silent, because you are cowardly, and you think way too much of yourself. There's my rant.
No, it was excellent. And I like this format because I think what you shared there is so important. It's a downer. It's a bit of a downer, but it also can be very empowering. And this is why we're doing the show. This is why we keep dragging ourselves back to the table when we've got other stuff going on. Because we just want to keep reminding ourselves and reminding each other that we have rights. That we as humans have rights. There are Bill and Melinda Gates and all these experts. They all think they should rule us, and we're just saying nope. You don't get to rule us. We'll ask you when we want your opinion, and then we'll decide. And we're going to retain that right, no matter how much science you throw at us. And we're not the ones who, I wonder if I caused an epidemic.
Gee,
You did. You did because you trusted the test more than the test needed to be trusted. You need to trust your patients. You need to trust in freedom and liberty. And that's what we're here for. That's why we're doing this.
We should probably say, too, Nick is doing great.
Yeah, he's amazing.
He's healthy.
He's
he's
a rock
strong.
star.
And
He is by
just
God's
doing
grace.
great.
By God's
Just
grace.
doing great.
And because his mama just would not let anybody hurt him. Like, just would not. She was with him the whole time when he was down in Geisinger, Danville. And she was there 24/7, just being there. I was actually, when all this happened at the beginning, I was actually working in Pittsburgh. I was 5 hours away. And she's a rock star. You're my idol. I love you, baby.
That's mama's job.
That's right.
All you
And
mamas out there,
that's
you
right.
be mama bear.
Do your job. Don't let anybody talk you out of it. Just do your job. Do what you know is right. And let the chips fall where they may, but fight for your kids.
That's right.
Fight for your rights. Stand up for your willingness to take responsibility for what you do. And it's not easy. It's not easy.
Nope.
It's hard to know.
It's really
But
hard to
trust-
stand there in the
trust
ICU
yourself.
when your child is dying and the doctors are telling you, if you don't immunize your child, I'm going to call Child Protective Services. And that is really hard to stand your ground in there at that time.
Right, but trust yourself and find professionals who will trust you,
Yeah.
who will respect you.
Yeah.